recent data favors monitoring, especially in the absence of symptoms or compromised tooth structure. So if 80% of the teeth we look at that appear to have a crack, if they're asymptomatic, the question in your mind should become, do you need to treat the tooth? If endodontic treatment is required, current literature would suggest that the outcomes are comparable to those teeth that are not cracked. So if you do the root canal on a cracked tooth, it's the same as if there was no crack, according to the endodontic literature. So one newest device that's come on the market dealing with looking at cracked teeth late last year is quantitative percussion diagnostics. So Sherilyn Sheets, I've known for probably 40 years. She's been on this passion to look at and helping dentists figure out if teeth are cracked. And it was initially developed to look at the stability and integration of implants, and so that will also play out. So this has been introduced late last year to look at, so FDA approved to look at analyzing cracks. So it's a non-invasive percussion taps on the teeth, 2.5 millisecond taps applied to the tooth, gives energy response, and that quantitatively measures the structural integrity of the tooth or implant, and it's AI-driven technology. So this is something I think we need to look at. And Sherilyn talks about the fact that there's 30 peer-reviewed articles referring to and analyzing this, but you have to look at this honestly. They're all based on articles that the team have published, so it needs to be looked at independently as well to verify, because one of the big concerns I think I would have in any situation based on everything we're currently doing are the false positives. So overdiagnosis and overtreatment. This study looked at about 3,000 teeth, 3-year period follow-up after diagnosis of a crack. Only 3% of the teeth identified with a crack fractured. Approximately 1/3 were recommended for restorations. And of the almost 2,000 untreated teeth, only 12% showed crack propagation. Generally, slow rate of crack advancement coupled with inaccuracies of available diagnostic tools, consider minimally invasive strategies for managing cracked teeth. So that's going to be not only my personal bias line, but it's also what the literature would support. This is the other article everyone needs to get. The International Association of Dental Traumatology guidelines. Everything is based on this paper, so published in 2020, and they did an amazing job, I think, in shading all different tables of different clinical scenarios. So here there's uncomplicated crown root fracture, so no pulpal involvement, and they go through looking at clinical findings, imagings that they suggest, treatment options, follow-up periods, favorable outcomes and unfavorable outcomes. There's all kinds of charts. There's no time to get into all the details of all the different fractures in teeth involving the crown and the root of the tooth, but please dive into this particular paper, because the American Academy Association for Endodontics is published their stance on this, which follows all of those guidelines. So if you want to find out what we in America are doing or what the endo literature talks about, it would be this paper. The American College of Prosthodontics has no position paper on looking at a fractured or cracks in teeth. So this is from the endodontic literature. So really valuable information, and this should be used as ready references. That's why I believe everyone needs to have it. So then you look at restoring teeth. You look at a peripheral rim of enamel, which is key for the strength of the tooth. Relative stiffness decreases the more extensive the preparation. So you do a class 3 restoration, the stiffness will decrease by almost 65%. So when you prep a tooth for an inlay, depending on the size of the inlay, of course, it's minimal loss of tooth structure, but almost everyone goes to complete coverage because that's what insurance is covered. And you look at almost 75% of the tooth is being lost when you go to a full coverage restoration, and we don't need to do that.